A strong command of medical vocabulary is essential for a high OET score. In the writing test, using precise medical terms ensures clarity and professionalism, while in the reading and listening tests, recognizing key medical vocabulary helps you better understand complex texts and audios. On the other hand, knowing exactly how to explain complex medical vocabulary in terms that your patient can understand in the speaking test is absolutely essential in order to get a high score. In this video, I'll share practical tips on how you can expand your medical vocabulary and understand how to use it in the OET exam. Many OET candidates struggle with medical vocabulary because they rely on memorisation techniques alone, but in fact the most effective way to remember and use medical vocabulary is by learning through context. Here are 3 proven methods that you can start using today to boost your medical vocabulary. First is to learn medical word families. When you come across a new word, try to learn the different forms of that word. Take the word diagnose, for example. This is a verb, to diagnose a condition. However, do you also know what the noun form is? Diagnosis. What about the adjective? Diagnostic. You see how when you learn a new word, you can learn the word family, the noun, the verb, and the adjective form if it exists. Understanding word families helps you recognize unfamiliar words more effectively in the OET exam. Here are some examples of useful medical word families you can use. Prescribe being the verb form to prescribe medication. The noun form is prescription. Next, we have the word operate, which is the verb. The noun is operation, the adjective operative. Next, we have administer, to administer treatment or medication, which is the verb form, and the noun form, administration. Next up, refer, a verb that you're probably very familiar with. The noun form is referral. A top tip for learning word families: when you learn one new word, find out if there are other forms of the word as well, and make sure you write them down. Say what form of the word it is, a noun, a verb, or an adjective, and then write an example sentence. Writing it in a sentence is going to give the word context and help to make it more memorable. The next strategy is to focus on learning medical collocations. Collocations are groups of 2 or sometimes more words that naturally go together. Using correct word pairings in your speaking and writing can help you sound more natural, so it's essential that you learn these. Here are 10 common medical collocations that you should learn. First up is to administer medication. It's a more appropriate way of saying to give medication, to administer medication. Adjust the dosage, meaning to change the amount of medication given to someone. If you say adjust the dosage instead of change the amount of medication, it sounds more professional and more natural. Discontinue medication. Instead of saying the patient was advised to stop taking the medication, in your letter you could write the patient was advised to discontinue the medication. Respond to treatment, meaning to get better after taking treatment. To undergo therapy, meaning to do or take therapy. Or this could also be used with an operation, to undergo surgery. Another very common one for OET writing, present with symptoms. The patient presented with X symptoms. Make sure with this collocation you use it with the preposition with. Experience side effects, meaning to have some kind of reaction to a treatment or medication. The patient experienced side effects. Rule out a diagnosis. If you rule something out, it means that you're making sure it is not something. For example, further tests were performed to rule out meningitis, meaning these tests helped us make sure that the patient didn't have meningitis. To manage a condition, meaning to handle or deal with a particular condition. And finally, to control blood pressure. If we want to talk about the act of keeping blood pressure low, we use the verb control. And these are just some examples of common medical collocations that are useful for the OET test. Our final method is to learn and use medical vocabulary in context. When you put new words and phrases into a context, it makes them more memorable, and it means you'll be more likely to understand and use them in the future. Memorising words alone isn't enough. You need to actually use them in a medical context to make them stick. So how can you do this? Well, firstly, you can practice reading through case notes and highlighting particular terms and phrases that you think will be useful. Listen to healthcare podcasts and write down new words and phrases and their meanings. And practice writing plenty of OET letters and reviewing sample answers to see how medical vocabulary is used in that context. Now let's talk about how you can master medical vocabulary for each part of the OET exam, starting with the writing test. The OET letter must be clear, concise, and professional, using a clinical and factual style. A major mistake many candidates make is not using appropriate language. So let's look at what language is and isn't appropriate for an OET letter. For example, if you're talking about a patient with high blood pressure, you might want to use the correct term for that, hypertension. Instead of using vague language like the patient has a lung infection, make sure you use the medical term. If the patient has pneumonia, use that word instead of saying lung infection. If the patient has high blood sugar levels, use the correct medical term, hyperglycemia. Now do keep in mind your reader. So if you are writing to a patient or someone who is not a healthcare professional like you, then you won't want to be using technical medical vocabulary that they don't understand. So always keep your reader in mind and use the language appropriately. Another thing that's important in OET writing is to use the right tense, especially when talking about medical conditions. For example, if the patient has hypertension, make sure you use the present tense has. If you're talking about something that happened in the past and is finished, use the past simple. The patient presented 2 weeks ago with chest pain and a cough. If you're talking about a planned procedure for the future, use the future simple. The patient will undergo surgery next week. So making sure that the medical terms you use are expressed in the correct tense is also very important. Now let's talk about how to appropriately use medical vocabulary in the speaking test. This is a very different situation because you're going to be speaking to a patient who doesn't have medical knowledge. Therefore, it's essential that you avoid medical terminology and you're able to explain it in layperson's terms. For example, you have hypertension, which means that your blood pressure is higher than normal. You've used the medical term hypertension, but then you've explained what it means. Another example, your X-ray shows a minor fracture, which means the bone has broken but is not completely separated. We've used the medical term fracture, but we've explained what it means. In your preparation, make sure you practice paraphrasing medical terms so that you're prepared to do this in the role play and make your communication more patient-friendly. Expanding your medical vocabulary doesn't just help with the writing test, it's also really important for reading and listening, as it helps you to identify and understand more complex language. Here are some ways you can improve your medical vocabulary for the reading and listening tests. Read plenty of healthcare-related texts such as articles, journals, magazines, anything that has a professional medical opinion. Read that because it's going to give you really good practice on identifying higher level, more complex medical vocabulary. For the listening test, do the same thing but with audios. Listen to podcasts, news articles, anything where there's a healthcare professional talking on a topic. That's going to get you prepared, especially for part C of the listening test. The more exposure you get to real-life medical conversations, presentations, and texts, the more comfortable you'll feel with the reading and listening tests. Remember, when you encounter a new word or phrase, make sure you write it down with a definition and maybe an example sentence in context. My final tip on how to improve your medical vocabulary for the OET test is to get expert feedback. Learning vocabulary by yourself can be slow progress, but with an expert teacher, you can improve much more quickly. If you're unsure whether you're using the correct medical terms in the writing test, an experienced OET teacher can read your letters and give you feedback. If you want to get feedback on your ability to explain in layperson's terms for the speaking roleplay, a teacher can listen to you and help you with that. At Swoosh English, we offer personalised one-to-one sessions, writing corrections and speaking practice to give you everything you need to properly prepare for your OET exam. Let us know in the comments, which medical topics do you find the most challenging in OET? We'd love to help you out. And if you'd like to keep learning about the OET exam, I recommend you watch this video next, where I'll be revealing the biggest lies about OET.